this is a little bit of a run through of the mental health module so that you can see what it's about but also how we developed it. I think it's important to see the provenance of the module and to know that it's legitimate and very up to date. So first I wanted to acknowledge Carl Andrews and Ben Caligari. They're our co-authors of the module. Carl in particular was the leader of the development and coordinating the research around the modules. And Ben, who's a clinical psychologist working at Northside Clinic with me, was our clinical lead. Let me just go to next. So the development of this module, it came out of some discussion that we were having on the AusPath Education Committee. So AusPath is the Australian Professional Association for Transgender Health. It has lots of health professionals, GPs, psychologists, psychiatrists, endocrinologists who work with trans people, particularly through their affirmation journey. And we identified on that committee that a number of health professionals were desperately in need of some health training in this area. First, we did a module for GPs, which is available through the Northwest Melbourne PHN as well. And second, we decided to focus on mental health providers because it's such an important need for this community, not just around affirmation care, but also around just general support of mental health and counselling. So from that, we did lots of searching for funding, and the Northwest Melbourne PHN came good. They very much supported this work, both the GP module and this mental health module. So we're very grateful to them and want to thank them very much for their support and ongoing support of this module. I'm working at Melbourne Uni with Cal, and we got some support through Melbourne Uni, particularly for the IT side of this development. Importantly, we engaged 2 reference groups to provide input into the content. The first was the Consumer Expert Advisory Group. That was quite a large number of consumers of trans health services who gave us lots of feedback about what they liked and didn't like about their mental health care. So that was very helpful. They also looked through the module with us, got the language right. We also had a clinical expert group, a number of particularly psychologists and social workers who helped us develop the content around their needs as well. So it's actually been out there for a bit over a year. You can see here some of the usage data that I pulled out. So already we've had over 400 enrolments, self-enrollment obviously, and people just work through the module in their own time. Mostly professionals, but some health professional students as well. And you can see on the right, quite a range of people, psychologists, social workers, also counsellors generally, a few psychiatrists and mental health nurses, and a big group of other types of counsellor. And I think this is important to know that this is a really broad module. It applies to lots of people in the mental health sector, to primary care as well. So everyone is welcome to use this. We asked participants approximately how many transgender, diverse, non-binary clients they saw per month, just to get an idea of their experience level. And you can see about a third didn't have any clients at that point, but were still interested to learn. Mostly just had a few clients and a few had lots. And then obviously there's a range of locations, and that's one of the advantages of these online modules, that you can do it wherever you are. So I'm going to focus mostly on what's in the module. So we started with an introduction and a self-assessment. So this was designed to think about your own skills as a user. What do you already know in this area? What do you need to know? And the self-assessment was also completed at the end of the module, so you could sort of compare where you were at beginning and end. In terms of terminology, that was a big one, and we find this a lot, that people get unstuck around what terms to use. It's not surprising because these terms are emerging constantly and changing constantly over the life of the development of the module. It changed and it will keep changing. So I think it's about understanding the current terminology. We'll try to keep this updated as well. You know, that little word cloud that we use as a little feature of the module, you know, that shows some of the terminology that is currently in use. Trans and non-binary are particularly commonly used words, but, you know, gender fluid, gender queer, gender diverse, they're all terms that people use, and you need to understand them all. Creating a welcoming environment, that's really important to be sure that a person feels comfortable and safe to disclose their trans identities and how they are going to help you share their journey. And also what the various roles are for mental health professionals. We then had a big section on assessment. This is partly because psychologists in particular are tasked with gender affirmation or gender test, if we call it that, gender history, around what is the person's journey around their gender affirmation, where do they want to head, if they want medical or social affirmation of their gender, and also what's happened to date around their mental health. So that's a really important starting point for assessment around affirmation care. Ben Caligari does a nice demonstration of how to take a really informed and inclusive gender history, particularly being inclusive of non-binary folk as well as binary trans people. Then we do quite a large number of sections on treatments and therapies. So part of it's about gender affirmation and the ways in which people can access that. We're trying to move away from a very gatekeeping role to a role that's more about support and care. So that's certainly embedded in the module. We've described a little bit around the access to GPs that can occur now in the so-called informed consent process that doesn't require a formal gender assessment. And that's okay for people who have pretty low risk mental health, which is a majority of people who are trans or gender diverse or non-binary. But we also move to how do you actually support a person's mental health, whether they're affirming or not, pre or post affirmation, and throughout. So quite a bit of detail around how to support mental health for trans folk, and a little bit about children, adolescents and families as well. And then a big list of resources, which hopefully will be helpful. So, you know, that's the nutshell version of the module. People can dip in and out. You don't have to do it in a linear fashion. You can just choose one area. So it's quite flexible in that way. One of the big parts of this module is a lot of videos. We've deliberately created videos to give trans and gender diverse non-binary people a voice, to allow them to explain their own experience. And hopefully that's helpful for providers to see a range of people in the sector. Also, this video from Megan and Karen, who are parents of trans young people, and also coordinate a parent support group. So I think they have some really important insights as well. So, you know, the videos, if nothing else, I'd love you to have a look at the videos and be sure that you've learned a little bit about the trans experience from them. So, strengths of the module, I think obviously that we've had lots of input and hopefully we've got it right, almost right around language and the right respectful language as well. We do deliberately increase the amount of non-binary content based on feedback we had about the GP module. You're probably aware that non-binary identities are increasing at the moment. There are lots of people who identify as non-binary as in their gender, and some would like to have some gender affirmation medical treatments and some don't. So, but I would say most have need of mental health support, and this is largely around the way in which they're perceived in society, the way that they or the traumas that they might experience from family of origin perhaps, or from workplaces or schools, largely because people don't yet really understand non-binary gender and how that works in people's lives. We've tried to be very strengths-based, using the recent ICD definitions around gender incongruence, rather than focusing on gender dysphoria, which had been a previous term, especially through the DSM. and lots of new content, as you could see. I think there are some challenges still some gaps. Obviously, can't cover everything in a module that takes approximately 90 minutes. But also, we're very aware that doing something online in your own time provides a little bit of introductory material. It doesn't provide you with the full skill set. So, you know, obviously there's still a need for face-to-face training, for learning on the job, for getting feedback from colleagues, for communities of practice, you know, all of these things that help build our skills. It's quite a dense module, there's lots in it. So, you know, if you were to do it all, as I said, it would take at least 90 minutes. And the interface is a little boring, but that's okay. So I'll just give you a little bit of the evaluation data we have to date. We ask at the end about whether the expected learning outcomes were met, and those that were entirely met, you could see between 80 and 95% of people felt they were. These are the learning outcomes that we're hoping people will achieve. So diversity around terminology, creating affirming environments, criteria for affirmation care, gender history, as I said, being familiar with the various roles that you can play, not just around affirmation, and so on. And just a few of the comments from those early participants. You can see there's lots of, I guess, support for the video materials and the consumer input. I think that's obviously been very well received. Someone wanted even more videos, so okay, let's go for it next time around. Some gaps, you know, they wanted a bit more time for case studies or for feedback on the responses. There's a bit of open text box answers that you can provide for certain areas, so that's good. We can work on that. So that's it from me. Hopefully that was a useful introduction to the module and how we developed it, why we developed it, and then what's there to look at. So thank you, and I'll finish there. Thanks.